In the US and here in Colorado, firearm injuries are now the leading cause of death among children and teens. In fact, the US Surgeon General recently declared firearm violence a public health crisis. Many of these injuries are unintentional, caused by easy access to unsecured firearms in the home. Nearly 80% of unintentional firearm deaths among children ages 0 to 14 happen in their own homes, often while they are playing with an unlocked and loaded gun. And over 80% of child and teen suicides by firearm involve a gun owned by a family member. Here's a more promising fact. Youth firearm injuries and deaths are preventable. Storing firearms safely, unloaded, locked, and with ammunition stored separately, can save a child's life and protect others in the home. In many states, including Colorado, safe firearm storage is the law. The most suitable, secure storage device is the one that best meets the needs of a family. Hiding firearms is not enough. Children are naturally curious, and studies show that 3 in 4 children know where firearms are hidden in the home, despite about 40% of parents thinking they did not. As trusted caregivers with established family relationships, pediatric professionals play a crucial role in safe storage education. Like counseling on seatbelt use or securing medications, counseling parents on safe storage practices for firearms helps mitigate the risk of death and injury to children. Studies have shown that parents and caregivers are receptive to this type of counseling and more likely to have firearms safely stored after discussing it with their pediatrician. So how can you work this into your visits with families? Start the conversation by asking about firearms as part of your safety screening or social history intake, in the same way you would ask about car seats, sunscreen, or medication storage. Instead of saying, "Do you own any guns?" which may put parents or caregivers on the defensive, presume ownership and ask, "If you have firearms in the home, how are they stored?" Emphasize the risks and present the data in a way that prioritizes safety. Position firearm safety as part of broader child-proofing efforts in the home, like securing medicine or chemicals. Describe safe storage best practices: unloaded, locked, and ammunition stored separately. While the safest home for children is one without a firearm, highlight tools and devices, like cable locks, available to families who choose to keep a firearm in their home. Acknowledge common misconceptions about children not knowing where guns are or not being interested in them. If parents don't own any firearms, don't miss an opportunity to ask if they've discussed gun safety with their kids. Teach kids that if they find a firearm, they should stop, not touch it, and tell a trusted adult right away. Also, encourage parents to discuss safe firearm storage with friends or family members who may own guns. Children can still face serious risks when visiting homes with unsecured firearms. Give parents tips for addressing the topic with friends or relatives before their child goes over for a play date. For example, they can ask, "My pediatrician recommends I ask about firearms. If you have any guns in your home, are they stored securely?" Encourage open dialogue and recognize parents' commitment to the safety and well-being of their children. Remind them that you're a resource to keep their family safe. Through AAP Colorado's Secure Their Future campaign, clinics receive cable locks and educational materials free of charge to distribute to families. We recommend putting cable locks in a clear storage container with handouts nearby. Cable locks should be visible and located where patients can take them anonymously. If possible, put them on the counters in patient rooms, waiting areas, bathrooms, or other common areas. Together, we can reduce the risk of firearm-related injuries and deaths among our children and youth. Join us to help secure their future.